I know folks will be trickling in. We had a lot of registrations for this. So thank you to the folks that are here now. And we look forward to those who will hopefully be joining us in a moment or two, maybe just getting an extra cup of coffee or something. Um, I am Kimmy Remus, she, her pronouns. I'm a prevention specialist at the partnership. And I am really happy to introduce our amazing guest speaker. Uh, I'm just gonna let you take it away, Olivia.
Sounds good. All right, everyone. It's nice to be here today. My name is Olivia Belknap. I'm an associate marriage and family therapist in California. I have my master's degree in marriage and family therapy, and I got my undergraduate degree in psychological and brain sciences. So we will have some brain related stuff to talk about today. As you can see from the title slide, we're going to be talking about COVID, and it's what you need to know about COVID in 2024, a conversation for DV agencies, social justice professionals, advocates, and preventionists. This presentation was created by myself and my wonderful friend and colleague, Erin Vitale, who is not here with us today, but I just wanted to give them a shout out as well because this presentation would not have been possible without them. All right, so I'll go into a little bit about structure for today. I'll try and leave some time for questions at the end. So I just wanted to kind of start us off with setting an intention. I know that a lot of the information that we might be talking about today might be new. Some of it might be upsetting or stressful to hear. A lot of feelings might come up when we're talking about these things, whether that's anger, fear, anxiety, sadness, defensiveness, all of that's okay. So I just want you guys to notice what's coming up for you, acknowledge that without judgment, noticing how your nervous system is responding to this information and doing what you need to do so that you can stay engaged and stay present today. I'll have a couple of brief pauses in between some of the slides so that you can take a moment to regulate and I can take a breath or a sip of water. And the goal isn't to do anything differently right now. It's just to stay open and listen and stay curious. So in terms of curiosity, when we're going through some of this material today, I want you guys to think about like what feelings come up for you when you consider the possibility that the COVID pandemic never ended, the possibility that COVID is worse than many of us might have thought, or the possibility that the impacts of COVID are not going away. If you used to wear a mask in public and no longer do, why is that? And what do you know about how the COVID virus has changed over time, over the last few years? And what might be preventing you from considering you might be wrong or maybe missing something in calculating the risk or the negative effects of COVID? So those are just some questions that I want you guys to keep in mind a little bit today as we go through. Excuse me. All right. So today we're going to talk about what is COVID, impact on the brain, impact on the body. We'll go into some social justice concerns, implications for relationships as it relates to DV as well. And then at the end, I'll jump in with some advocacy and resources that you can use for yourself or share with clients, friends, colleagues, all that stuff. So I wanted to start with some going over some like myths and misconceptions or some information that was considered like gold standard best knowledge in 2020 that now we know some of those things are actually outdated or not accurate anymore. So I wanted to just kind of get us all on the same page today before we get into some of the weeds of some of this information. So a misconception might be that the pandemic is over. We actually know that the pandemic is ongoing and it's the public health emergency that's ended, at least if you're in the US. Another misconception is that it's mild or it's just a cold. Unfortunately, we know that COVID leads to significant long-term health problems. And we'll talk more about what that looks like and who that's impacting. In 2020, we thought that COVID was spread through droplets, like, when you sneeze and you get that little bit of spray out there. Now we know that it's airborne. So it kind of moves through the air like smoke. And it can hang in the air for hours. So even if you walk into an empty room, if it's poorly ventilated, there could be COVID hanging in the air that you could breathe in and be infected by. Another misconceptions might be that masks don't work. And we know that for airborne transmission, N95 masks are going to be the best protection, more so than the surgical or cloth masks that you might have been wearing at the start of the pandemic. Another misconceptions are that vaccines are all we need to be protected from infection or that vaccines don't work. Actually, we're somewhere in the middle there. So vaccines reduce the rates of death, hospitalization from infection, but it doesn't prevent you getting COVID or spreading COVID. So it's important to stay up on your boosters. And it's best to use alongside other safety measures as well. So it's not going to be the one thing that'll protect you, but it is important to continue getting your boosters. Another misconception is that only certain groups of people are impacted. So you might have heard like, oh, it's only the vulnerable, maybe it's those older people, compromised people, but we know that anyone can get long COVID, regardless of what sort of demographic you're in. Another misconception might be that you can only get COVID once. Excuse me. So we know that there's no limit to the number of times you can get COVID, and that damage can be cumulative, unfortunately. And there's no lasting immunity either. I think there was the idea for a while that, okay, you got COVID, maybe for the next couple of months, you're going to be protected. But because there are so many different variants out there, you can actually be reinfected within just a couple of weeks if there's a different variant. Another misconception is that it only spreads indoors and that outdoors is safe. We know outdoors is safer, but outdoor spread is absolutely real. We are seeing COVID in a lot of animal populations, especially like white-tailed deer, and they're not getting that from, eating inside restaurants. So we know outdoor spread is definitely possible. Another misconception, only needing to isolate for 1 to 5 days. I know those guidelines have kind of shifted and changed over the last few years. But it's best to continue isolating if you are symptomatic or if you're still testing positive. And then the last one, if I don't have any symptoms, then I don't have COVID. We know that about 50% of COVID spread is from asymptomatic infections or pre-symptomatic infections. So either you don't have any symptoms at all, but you're still able to spread it, or it's those few days before your symptoms start to come up where you could still be contagious. So these are just some of the common misconceptions that I kind of wanted to clear up before we get started today and some of the deeper information. So as I mentioned, I got my undergraduate degree in psychological and brain sciences. So I like the brain, I like neuroscience. And we know that COVID is neuroinvasive, which means that it can get up inside your brain, it can cross the blood-brain barrier, which is something that a lot of other viruses cannot do. It can have a lot of brain impacts, as you can see listed here. I won't go through all of them, but some bigger ones, I would say, like depression and anxiety. As a therapist, this is something that I'm seeing a lot. Insomnia, increased suicide risk, particularly in the couple of weeks after an acute infection, increased risk of cognitive impairment. So whether that's brain fog, seizures, dementia, psychosis, other neurocognitive conditions, this risk has continued for at least 2 years following infection. And it's probably more. Usually when you see studies that say, oh, up to 2 years, it means their study ended after 2 years. So that's something to keep in mind as well. We are seeing an overall reduction in brain size following an infection. And this is for folks whether you've been hospitalized or not. So we're seeing similar rates. And some of these neurological symptoms can have a delayed onset, whether that's weeks or months, and they can worsen over time. Some of these brain changes might appear similar to ADHD. So that's something to keep in mind as well, something I'm seeing in my practice as well. And some of these people might not recognize that they're having this cognitive impairment. So they're not going to be able to report that because they're not seeing that coming up as an issue for them. So I wanted to lay the foundation for that in terms of the brain. But when we're thinking about long COVID, it's experiencing symptoms within 3 months from the initial infection that last at least 2 months. And for some folks, this has lasted many years. There are some people who were infected early in 2020 and that are still experiencing debilitating symptoms to this day. And so we know that long COVID is impacting about 20 to 30% of all patients, more so 50% if you were hospitalized during your acute infection. But the majority of long COVID cases are in non-hospitalized patients that had a quote unquote mild acute illness. And when we say mild, when we're talking about COVID, that basically means you weren't hospitalized. So you could still have had really, really difficult symptoms, but if you were able to get through it at home, that's going to be considered mild. And long COVID can be difficult to pin down because there are over 200 potential symptoms. This is according to the American Medical Association, and it can impact all of the different systems of our body. So I think a misconception, another one, is that COVID is just something that has to do with like the respiratory system, right? But COVID is actually a vascular disease. So that's going to be impacting our blood vessels. So any part of our body that has blood vessels has the potential to be impacted by COVID. So it's pretty much all of them. So it can cause all of these different body systems to be impacted. And I'll go into those a little bit more on the next slide. But a lot of the things we're seeing are like heart issues, higher rates of like heart attack, stroke, pulmonary embolisms, immune system dysregulation. So there are some people that are getting like basically AIDS from COVID because it does damage the immune system, which makes you more susceptible to some of these other infections, which we're seeing like increased rates of throughout the population. A lot of GI, gastrointestinal issues as well. I think people think, oh, I'm not coughing, I'm not having these respiratory symptoms, it can't be COVID, but COVID can also present primarily as like a gastrointestinal issue as well. And it also is impacting reproductive systems. So we know that increasing rates of birth issues, maternal health, miscarriage, stillbirth, all of those things. So if you are a pregnant person, protecting yourself during pregnancy is particularly important. And I like this quote down here at the bottom. We should not be thinking about long COVID as something that happens to certain groups of people. It can affect anyone of all ages. So a little bit more about long COVID. About 50% of people who have long COVID meet the criteria for ME/CFS, myalgic encephalomyelitis. There we go. It's a tricky one, which is a neuroimmune illness characterized by an intolerance to systemic exertion and chronic fatigue that cannot be alleviated via rest. So this can be really debilitating. Some people are pretty much like bedbound, unable to do like most basic tasks at the most severe level of it. And listed here are some other different potential symptoms as well. Like I said, there's such a wide range of what it can look like. It's going to look different person to person. But like some weird ones too, like hair loss, new cancers, blood clots, inflammation, changes in sensitivity to medication, facial paralysis, sleep disorders, autoimmune disorders. Like there are just all types of kind of weird, wacky things that can happen following COVID. We know that COVID is capable of inducing multiple systemic and organ lesions. About 70% of individuals with long COVID are showing evidence of damage to at least one organ. And some of this damage could be silent, so you might not recognize right away that this is going on, but it can impact all of these different body systems that we have. And because there are so many different body systems that are being impacted, there are a variety of theories about like what are the causes of some of these different issues. So some of the potential pathways are inflammation, whether that's neuroinflammation in the brain and autoimmunity, reduced serotonin, which we see in the brain and in the gut, and vagus nerve dysfunction as well, autonomic dysfunction, which is kind of like those body systems of like regulating your heart rate and your blood pressure and your digestion and all of those things. As I mentioned earlier, COVID can cross the blood-brain barrier. We're also seeing viral persistence. So it can kind of like set up little pockets in your body where the virus like still lives and thrives, even if you think that, you've gotten better after the acute phase, there could still be parts of your body that are still harboring virus that are impacting your organs. Organ and tissue damage, as I mentioned earlier, and microclots as well, that's impacting either like pulmonary embolisms, stroke, heart attack, all of those things. So you might be wondering, like, okay, who is high risk for long COVID? So according to the CDC, that's all these different conditions listed here. And this is not an exhaustive list as well. And so I want to highlight a couple. People from racial and ethnic minority groups are considered higher risk for long COVID. Pregnant people, infants, adults 65 plus, neurodevelopmental disabilities like autism or ADHD, If you're immunocompromised, whether that's, because of an illness you have or a certain medication that you're taking to treat a different illness, connective tissue disorders, mental health conditions like mood disorders. So whether that's major depression, bipolar, things like that. If you are a current or former smoker, if you have heart conditions, HIV, diabetes, autoimmune diseases, mast cell activation syndrome. And some of these things on this list can be caused by COVID in the first place, like diabetes or autoimmune conditions or mast cell activation. So even if you don't have some of these things prior to an infection, you can develop them after an infection, which then leaves you higher risk for a subsequent infection. In this data we have here from 2021, about 75% of US adults had at least one increased risk condition. Excuse me. About 40% had two or more, and a little less than 20% had three or more. And so keep in mind, this is from 2021. I wish I had more updated numbers, but I really think that it would be much higher at this point, considering that the vast majority of the population, at least in the US, has had at least one COVID infection, and how we know that it can cause some of these risk factors. And psychiatric disorders are associated with increased risk for hospitalization during the acute phases as well. So again, as a therapist, this is something that I'm keeping in mind. So just a few more things about long COVID. The risk increases with each subsequent COVID infection. So the more times you get COVID, the more likely you are to have long COVID. Currently, there are no proven effective treatments, partly because there's no one identifiable cause. It's going to look different for everyone, like we talked about a few slides ago. Associated with other pre-existing conditions, like we mentioned, and symptoms can last weeks, months, or years. Some of these conditions will be lifelong, and symptoms can remit and then return as well. I know there are some people that, had various symptoms of long COVID, were able to improve, and then got infected again and kind of went back to where they were in terms of symptoms or even potentially worse. So that is something to keep in mind as well. And about 10 to 30% of those who've had COVID will develop long COVID. And some studies are showing higher rates as well. So that is pretty significant. I think that's something important to keep in mind as well. So I'm just going to pause here for a second. I know this is a lot just to go through in a short period of time. So I want you guys to just take a minute, kind of reflect on how it feels to hear some of these things. So transitioning a little bit into some social justice considerations, we know that COVID disproportionately impacts BIPOC folks, women, the LGBTQ plus community, as well as low income and disabled people. Accessing medical care is definitely a big issue. When the state of emergency in the US ended, whenever that was, 18 months ago or so, that removed a lot of social supports. So people who were previously being helped with certain programs, those were no longer available to them. Private companies started increasing cost of a lot of treatments. It used to be a lot easier to go get, say, a free PCR test just down the street. A lot of places then started charging sometimes like $150 or more for a single test, which is prohibitively expensive for the vast majority of people. Well, these private resources started shutting down. Excuse me. There was a wonderful organization local to me that would come to your house to do a PCR for free. And then it was, okay, it's only going to be covered if you have these certain types of insurance. And then the company shut down completely. So made it a lot harder to access some of these resources. And then patient gaslighting from the medical system, excuse me, is also something that we're seeing a lot. So patients are coming in saying, hey, like I have these weird new symptoms. And a lot of them are being dismissed or not believed, particularly if these patients are women or gender nonconforming individuals. This is something we're seeing a lot too. And a lot of this ties into ableism as well, which one definition that I have here is a set of beliefs or practices that devalue and discriminate against people with physical, intellectual, or psychiatric disabilities, and often rest on the assumption that disabled people need to be fixed in one form or the other. Disabled people are actually the largest minority group in the US, about 25% of the population. And then, similarly as well, we know from some studies that have been done by NPR, the more people perceive there to be racial disparities in the impacts of COVID-19, the less fearful they were of COVID, and the less they supported safety precautions to prevent the spread. So there is definitely an element of racism in this as well. And I have just a couple of these graphs to kind of demonstrate. These were from September 2023, so a little bit more than a year ago. And you can see here that white people were significantly less concerned about acquiring and spreading COVID. This is shown in a couple of different charts here, but in terms of like wearing a mask in public, avoiding large gatherings, traveling, being less likely to dine indoors, white people were on the whole doing less of these precautions. And it seems that this was definitely connected to the understanding that Black and brown people were disproportionately being impacted by the virus. So some more on social justice considerations. COVID is a workers' rights issue. We know from the study in 2023 that public-facing industries, so teaching, education, social care, healthcare, civil service, retail, transportation, all of those things had the highest rates of long COVID, which totally makes sense with the public-facing, seeing a lot of people on a regular basis. And a significant portion of those people having long COVID reduced their functioning by a lot. And from 2022, around 16 million working age Americans, so between 18 and 65, have long COVID, and between 2 and 4 million were out of work due to long COVID. So when we think about that, and I'm sure these numbers are increasing, but considering the impact of worker shortages on various industries, so what is that going to look like when a large portion of teachers aren't able to be in the classroom? There is a shortage of nurses and other healthcare workers, pilots, drivers, and even if they are still in the workforce, if they're dealing with these long COVID symptoms like brain fog, difficulty concentrating, paying attention, we're seeing an increase in car accidents following COVID. Insurance companies are definitely aware of this. Premiums are going up. And then also paid sick leave. A lot of people maybe don't have the opportunity to stay home if they're sick and isolate, even if they would want to, because that means missing out on wages so that they're not able to provide for themselves or their family, or childcare, like who is going to take care of your kid if you're sick, access to healthcare in general, like Paxlovid, which is one of the treatments for acute COVID, I think has recently been raised to like $1,500 for like a 5-day course or something. So again, prohibitively expensive for quite a number of people. Protective equipment like masks, and all of those things, a lot of people are having to try and purchase or access these resources on their own. So this isn't something that's being provided to them by their company or whoever it is that they're working for. More and more people are going to be needing disability accommodations as well in the workplace. And that's something that can be difficult to get. And then the question of like, who's liable for infection? Like if you're infected on the job, like, is that your employer's responsibility? Is that your responsibility? Who is going to take care of you if you get sick or if you can't work anymore, or need to work fewer hours? So I don't know if any of you are familiar with Alice Wong, but she is a wonderful disability justice advocate. She has written a couple of books, and she's someone who can't wear a mask in public because she has a trach, so she doesn't breathe through her mouth and nose. And she says in a recent article, when I'm in public spaces and see most people unmasked, either because they think the virus is a hoax, that masking is virtue signaling and a sign of weakness, aren't thinking about it, or they simply don't care, I feel like an expendable burden not worth saving. And in her same article, she quoted Angela Here at the bottom left, the psychological toll of trying to keep ourselves safe with no institutional support, and in fact, quite a bit of institutional propaganda that we are being hysterical, is an ongoing source of trauma. It feels like I'm screaming into the void. And in my practice as a therapist, I work with a lot of clients who are continuing to take COVID precautions, many of them because they have disabilities or various illnesses. And this is something that I'm hearing from a lot of folks is that, being in this pandemic with so many people in their lives are ignoring or denying how this is impacting them is deeply painful and deeply traumatic. Um, and Kimberly Vered is one of my colleagues. They're a COVID conscious therapist as well. And they said being chronically ill right now means navigating systems with constant reminders of how little the people in those systems value you. We emotionally support each other when the world seems to want to forget we exist. I think this is something that we see a lot when, disabled or immunocompromised people try and share how dangerous it is for them to try and access their basic needs or go into public spaces, and they get the response of, well, you should just stay home, is one that we hear a lot. I think that's really unfortunate. It shows how little that our lives and our well-being is valued by the general public. And I think that is also, contributes to that ongoing trauma that a lot of us are facing. And so in terms of the LGBTQ community, they're also disproportionately impacted by COVID and long COVID. As you can see here in the top left, and this is recent too, this is from 2024, just a couple of months ago, can see that when you look at the rates of long COVID between cisgender and transgender adults, that trans adults have rates of long COVID of about 26%, which is significantly higher. You can see too that it does have a higher impact on cisgender women as well in comparison to cisgender men. I think there are probably a variety of reasons for that, mainly because women are more likely to be in some of these like caretaking roles, as well as women are more likely to have autoimmune issues. So I think there is likely some sort of predisposition there, but I'm sure there are a variety of factors that are contributing to this. And then you can see here as well, a little bit more than 28% of bisexual adults are impacted by long COVID, which is significantly more than the 16.8% of straight adults. And then I have these two quotes here from trans author and activist J.D. Davids, who says, allowing COVID to proliferate is going to continue to worsen health disparities, particularly in a country where in some places it's literally illegal to give appropriate health care to trans people. This is something that we are seeing a lot of concern about, particularly in those states that are less friendly to trans people and trans health care. And he also says, of course, trans people have higher rates of long COVID. We have lower rates of being treated as humans. People who are denied access to healthcare, resources, or bodily safety are at higher risk of ill health outcomes, including this massive disabling event known as long COVID. And I wanted to highlight as well long COVID in kids. Before I started the position that I have now as an associate, I was doing my traineeship at an elementary school. And I saw firsthand how long COVID is impacting kids. There were a number of parents that very explicitly said to me, like, my kid got COVID and they were never the same. They are always sick now. They can't participate in PE. They've missed 50% of the school year. They are, throwing up every couple of weeks. I'm having them in and out of the doctor. I don't understand what's wrong. And this is really devastating for families. And we're seeing that in kids, long COVID is showing up in like similar rates to adults. So I think that was another misconception early on in the pandemic, was that either kids don't get COVID or they don't spread COVID, or it's mild if they get it. But we're seeing a lot of the same types of organ damage and other impacts. As you can see here from this diagram on the right from a recent study, kind of lists all of the various potential symptoms from different body systems that kids are experiencing as well. And then long COVID families created this graphic here on the left as a wonderful resource. Signs of long COVID in kids look different than adults, or it can show up differently, especially for younger kids who maybe don't have the language to express what's going on with them. Like your 6-year-old isn't going to come home from school and say, Mom, I'm having some post-exertional malaise. They're just gonna say, I'm tired, I don't want to go to school. I don't want to go to soccer practice. So I would see that as well, where kids were clearly struggling with health issues and parents or families were like, oh, he's just lazy. Like he just doesn't want to go play sports. Like, no, I think this kid is like really struggling right now. So that might manifest as in behavioral issues or drops in grades or school performance, especially if there's cognitive issues going on. It might be food avoidance if they've developed like mast cell activation syndrome, which is kind of similar to like an allergy. So like new food intolerances can show up a lot with long COVID as well, or new sensory issues, like some of those neurocognitive things might bring more like light sensitivity or things like that. But this is definitely impacting children as well. And I think that's something really important to be aware of because, kids can't consent to being infected repeatedly. I think, making sure that we are like increasing safety in schools by like upgrading ventilation and air filtration it has shown to be hugely effective in decreasing the amount of sickness. I'm sure many of you guys have seen things of like attendance rates are terrible and we need to get kids back in the classroom. Well, helping prevent them from getting sick over and over again will definitely help with that. All right, another pause. How are you feeling after hearing some of this information?
And Olivia, I just don't know if you've been able to see the chat, but people have said that this makes a lot of sense. Someone's texting one of their coworkers as long COVID, and that this has been really like that they know their struggles, and that it's overwhelming on a daily basis. And then I've just also been chiming into that this resonates with me, and that like I was lucky I can donate air purifiers to my daycare. There's been some kind of movement around that, around folks like trying to kind of build the supports if the school can't, but understand that that's not accessible to everyone.
Yeah, totally. Thanks, Kimmy. Yeah, it's hard for me to keep up with the chat while I'm sharing screen and doing the slides. So appreciate you keeping me in the loop there. And we'll have some time for questions at the end too, for anyone who has any thoughts. All right, transitioning a little bit into couples in relationships. So we know the study was from 2022 that 34% of US adults reported conflict with their partners related to their COVID-19 health concerns or the continuing prevention measures. I know this is something I'm seeing a lot in my practice. I work with a number of couples where the main issue they're coming in with is someone wants to continue taking precautions and someone else doesn't, or they're both willing to do it, but they're kind of navigating what that's going to look like for them in their relationship. And I also run groups for people who are continuing to take precautions. And this is something that a lot of my therapy group members have shared as well, that this is a difficulty that they're experiencing within their relationship or their family of trying to be on the same page about safety measures. And I asked on social media too, like, how has COVID impacted your relationship? And I got so many responses. I was really excited about that. So I just put a few of them here because I thought it would be kind of helpful to see different perspectives. So one person says, a 3-year relationship I thought would be lifelong ended over different levels of precaution. This is something I've heard from a lot of my clients as well, is that they have had long-term romantic relationships end because of differences in this area. This other person says, it doesn't help when your in-laws don't believe in precautions either and causes tension indirectly. Another one says, they started engaging in high-risk behavior and lied to me about them. This is a really difficult one as well that I see. When you think you have trust in someone to protect you, and they're not doing those things, it can be really devastating and immensely harmful, especially if you're already someone who is chronically ill or high risk. And this last one here is by another COVID conscious therapist. And she says, it is absolutely an issue for couples and parents and children with siblings who aren't approaching the pandemic in a similar fashion, etc. When you share air and everything that comes with it, individual actions have collective consequences. It's tough. And I think that's a really important point. Something I hear a lot is like, well, it's my personal choice. I don't want to mask. I don't want to do those things. It's my right to, decide whether I want to do this or not. But there are collective consequences because this does impact all of the people that you're sharing air with, whether you know it or not. And then this definitely ties into intimate partner violence as well, unfortunately. So this study, I believe, yes, from 2024, so this is relatively recent as well. I think this was out of Australia. They saw that the partners weaponized the patient's long COVID symptoms to further perpetuate abusive and controlling behaviors. And so one person in this study said that they were too unwell to even consider leaving their abusive partner. So if you're someone that relies on someone else for caregiving or support in that way, you don't have a lot of options. And so a lot of people are stuck in really terrible situations because they just physically, they don't have a choice. And then another quote from someone when I asked this question from the previous slide, this person said, my boyfriend isn't masking me anywhere or taking any precautions, even though I'm immunocompromised. I can't afford to leave, so I kind of just have to pretend to be okay with it. And that's something I see a lot too, of feeling like I can't bring this up. They're going to get mad at me if I don't want to rock the boat. The majority of the time, it often is the women, if it's a heterosexual relationship, where they're the ones who are trying to continue to be safe and protect themselves, and the man in the relationship is not willing to do so. Not all the time. I definitely have, couples or people in my groups where it's the reverse dynamic, but the majority of the time, it does seem to be the women who are in these situations. So again, disproportionately impacting women here. And then changing relationship and family dynamics due to health issues. I think this is something important too. So, like, what happens when one member of the couple is no longer able to perform the care duties that they used to? I've seen couples where COVID precautions are the main issue that they're dealing with, but then distribution of labor can also be an issue as well. Maybe one person is disabled or became more disabled because of COVID, and now they can't contribute in the ways that they used to. How is that going to impact the relationship? It can cause frustration or resentment for some folks. Personality changes or increased anger and aggression is something that we're also seeing following a COVID infection. As I mentioned earlier, like the impacts on the brain. And that's something that's really scary. Like if someone feels like their personality has changed or they feel like a very different person, I'm not feeling safe here in this relationship or in this environment anymore. Loss of income due to health issues is another one. I know that, money and finances is often a really big topic for couples, something that they're going into therapy to kind of deal with. So if that's something that's coming up, if someone has had to decrease their hours or stop working completely due to new health issues, how is that going to impact their relationship or the family system? Loss of sexual functioning. As I mentioned, like the reproductive impacts, COVID can cause erectile dysfunction. I think that's maybe something that's a little less well known. How is that going to be impacting the relationship? If someone isn't able to perform in that way, or maybe it's that they have some really bad depression following an infection and that has decreased their sexual desire, and how is that going to impact the relationship as well? And then partners unexpectedly having to become a caregiver is going to have a really big impact on the relationship dynamic. Maybe that wasn't something that you were expecting, but now has kind of fallen into your lap. I think that can be really difficult for people too, on both sides, whether you're the one who is being cared for or is doing the caring. That can be a really difficult dynamic that can come up. So I think that's something to keep in mind too. But especially if you are relying on a partner for your care, like that is, a way for abuse to happen is even just like refusing to provide that care. Um, or on the other side where they said that, my partner was telling me they were masking, but they were lying and they weren't doing that. It reminds me of, you know, someone who is, having sexual relationships with someone else other than their partner, whether that's something they've agreed upon or not. But if they're not using protection in that way, then you could potentially bring something back to your partner that they wouldn't have been okay with if they didn't consent to, that can impact their long-term health. So after all of this, you might be wondering, like, okay, like what can I do? How can I make a difference? So there are a lot of ways that you can make spaces safer and more accessible. I know for me as a therapist, when I would give this presentation to other therapists, we would talk about doing telehealth. So I know that folks listening today are from a variety of different fields. So maybe that means remote work options, virtual meetings, wearing masks or respirators when you go out in public or in your office space, cleaning the air, getting some HEPA filters for your office or for your home, making those spaces safer for everyone is good for everyone. Mask blocks are a really wonderful resource. They are like local grassroots organizations that provide free masks to the community. Some of them have like lending libraries of air purifiers that you can use for if you're doing an event or something like that. So I have the link here and at the end as well for the maskblock.org where you can find your local mask block. There are actually a lot of them all over the country, which I think is wonderful. Wearing a mask, especially in spaces that are essential spaces where disabled and immunocompromised people have no choice but to go to. So that's going to be like doctors' offices, pharmacies, public transportation, grocery stores, things like that. I know that the idea of, masking everywhere again, especially if that isn't something you've been doing, can feel really overwhelming. But I think even just increase the number of places that you do mask makes those spaces more accessible to everyone. And then advocating within your community spaces, whether that looks like asking your doctor's office to implement a mask requirement, donating an air purifier to, your kid's preschool or the local library or whatever that looks like, or even just sharing information about COVID and long COVID with the people in your life. I think, unfortunately, like the public health system has done a very poor job of keeping the public updated on what we know about COVID and how it impacts people. And so even just bringing awareness, I think, can be really huge for people to have a better understanding. I think a lot of people don't even know what long COVID is. So even just saying, hey, this is a thing can help people go, oh, wow, maybe that's what's been happening to me or one of my loved ones. So I have quite a few resources here, and you guys should have access to these slides, I believe. But some good ones here in terms of information, like what to do if you have an acute COVID infection, different like Paxlovid or other care things that you can do for yourself, more information about what is long COVID. This one here, up-to-date research articles, it's actually wild how many they have and how much it has increased in the past few months. But like hundreds of thousands of studies about long COVID. It really grinds my gears when people say, well, we don't know too much about it. No, we know a lot. We know a lot. There are a lot of studies. Long COVID families, that organization that had that graphic that I showed on the kids slide. The People CDC is a great organization as well. And then the regular CDC, their wastewater data, because we're not tracking COVID cases the way we used to. Wastewater is actually a way that we can continue to get a more accurate read on what the numbers are in your local area, because we shed COVID when we poop and stuff, and then it goes into the sewers, and then we can do tests there and figure out like how much COVID is around. So that could be something to keep up with as well and kind of inform you like, are we in a big wave right now? How is this looking in my community? This COVID Safety 101 is a great resource that someone has put together. I have, again, the mask block finder. Definitely recommend donating or volunteering with your local mask block. Some of these other links up here are for high quality masks. I know it can be hard to figure out like which ones are the good ones, but those are some there for you if that's helpful. And then, didn't mean to move my whole computer. Community care, some support groups, advocacy groups. Would definitely recommend that. The COVID Conscious Therapist list, which I'm listed on, is a great resource as well. And then other community events that I thought might be helpful resources. So these will all be here. And then, yeah, just some kind of discussion. Let me see if I can open up the chat again.
The things that have happened since are it's heartbreaking the lack of system and support in place. It makes me angry regarding anti-masking. There's also a question about if the slides will be available, and this plus the recording will be on our resource library either later today or Monday. And thank you for all the information. Very much appreciate it. And I also put in that if you sign up for some of the websites that like sell masks, like you can get like emails. Like I've been getting so many Black Friday deals, emails and things like that. So I only buy my high quality masks when they're like major sales, because otherwise it's expensive. We got another one from Crystal. Thank you for this webinar, super informative.
Does anyone have any questions? Happy to do my best to answer anything that you guys might be wondering.
Do you find your clients typically are ones who are already kind of like aware of things that are happening due to COVID, or are they kind of surprised when you bring this information up to them?
The majority of my clients have found me because of the COVID work that I do.
That's
So
what I thought.
almost all of them are like pretty aware and they're happy to find me as a provider that isn't going to pathologize them continuing to take precautions. I think it's really unfortunate, something I've heard from my clients or other people across the country, these like really sad stories of them working with therapists or other healthcare providers that have tried to say that they are crazy or that they need to be treated for OCD because they are continuing to take precautions, or that it is unhealthy for them to do so, which is just wrong on so many levels, in my opinion. So a lot of my clients are just happy to know that they can talk about COVID, they can tell me what they're doing with their precautions, and I'm not going to shame or judge them for doing that. I know like the feedback that I've gotten, especially from running my groups, is that it has been like huge for like mental health and well-being to be able to connect with other people who are doing the same things or living in this shared reality, especially because the majority of them, the people in their lives, they're the only ones who are still masking or still, taking precautions in general. And that can be really difficult for folks. So yeah, there's very, very few of my clients are not people who are continuing to take precautions. So I don't think it's a surprise to many of them when we talk about these things, because they found me because this has been a lot of the work that I've done
Mhm.
post grad. Yeah, I'm seeing in the chat about long COVID. Yeah, I think Kimmy, you said that you'd be able to share the copy of the slides with everyone. Yeah, feel free to share these slides with anyone that you think would benefit from knowing about some of this information. I would definitely recommend Long COVID Kids and Long COVID Families. Those are two different organizations that focus on how long COVID is impacting children. Yeah, I think this is definitely Um, Something that a lot of folks don't know about or don't realize. So if you have kids, definitely would recommend like advocating within your school system for cleaner air. I think actually it was within the last couple of weeks in California that they have
They did
put,
actually, yeah.
yeah, to like improve like the HVAC systems in public schools, I want to say.
Yeah, I need to find where that was. You're right. This did just come out from the CDPH. I remember like noting it. Um, but I don't know if this is the exact one, but I'll put it in the chat. This is the first thing that came up when I Googled.
Yeah. And if you're interested in indoor air quality advocacy, Lisa McConchie does a lot of that work. She's really wonderful. So I definitely recommend. She has a Twitter. You can find her website as well. I think it's just her name, but she's doing a lot of that advocacy work in the San Diego area in terms of getting clean air in schools. So she's another great resource as well.
Do you think that if like I've heard from some organizations, and I know it's been a thing for us too, when we like one of our first like back in-person events, for example, we were Project N95 still existed, so we got all donated masks and tests and things like that. And because of the cost kind of on an organizational level, do you think these are things that folks would be able to access if it was written into their grants? And do you have any like ideas on how to go about that?
Yeah, that's a good question. Yeah, Project N95 used to be on the resource list and then it shut down. I think this is probably the fourth or fifth time I've given a version of this presentation within the last year. And every single time I give it, I have to delete a ton of resources from the list because they just keep going away, as I mentioned in one of the slides about how a lot of these private resources are no longer available or accessible to people. So yeah, I think like um, I'm probably not as familiar of how to go about like, funding or grants or things like that, but I think, putting that into the budget of, masks, tests, HEPA filters, all of that stuff, definitely be really beneficial. Or if there are events that you're hosting, like getting in contact with your local mask block to see if you would be able to get any donations from them as well. I know that they do a really great job of trying to um, make masks more accessible within the communities.
Thank you for that.
Any other questions? And then I have all of our lovely references. So if you are interested in looking at a specific study, they should be there at the end. Got quite a lot of them.
Yeah, thank you so much. That's fabulous. To have all this like evidence-based information. Thank you for doing this for us today. Um, I'm also going to put in the chat some of our upcoming events for folks. We have our Economic Justice Peer Learning Circle in December, as well as our Economic Equity in Action Forum. So folks can sign up for both of those. Olivia, do you have contact information, or is that in your slides that folks could access to?
I was actually just about to put, where is it? In the chat, you can contact me through my website. I know on another version of the slides, we had our contact information there, and it seems like it did not get transferred over to this particular version. So you can find me at oliviabelknaptherapy.com. I just put a link in the chat. I've created some other COVID resources as well that folks have found helpful. These like little one pagers, like why I take COVID precautions, why your patient is COVID cautious, long COVID info sheet, and COVID safety is an anxiety disorder, as well as just some fun like little graphics about masking and self-advocacy and things like that. So I have some things there as well. But yeah, on my website, there is a contact form that will send me an email. So if you want to reach out to me for whatever, happy to answer any questions or support y'all in any way that I can. But yeah, this is definitely work that feels really important to me. I personally developed long COVID after an infection in 2022, and it really kind of spurred me to learn more about this and start trying to advocate and share this information with as many people as possible. So this is something I'm really passionate about. As I mentioned, this is like a lot of the work I do with clients as well. So if you have anyone in your life who's in California, who is needing some support, who is taking COVID precautions, feel free to share my information with them. But yeah, happy to answer any other questions any of you guys might have.
Folks may be just digesting, which is why I appreciate the contact information. So that way, if anyone has any follow-up items, they can reach out. Thank you all so much for being here. Thank you again, Olivia. This will go in our resource library, which folks can find by going to our website, cpedv.org, and then it's like all the way on the right tab, resources. Again, I'm going to try and get that up today. Might happen on Monday just because things pile up on Friday. I'm going to stop the recording now, but thank you all so much again.